Hi everyone, welcome to week 10 of your Pharmacology 1 course. This week we are covering chapter 12, although you do not have an actual assignment this week. So there is nothing to actually turn in. You don't have to turn in the questions or anything like that. Your one focus for this week is to complete the final exam. That must be done by Thursday. I cannot accept anything after Thursday. So that's your main focus. There's no discussion. There's no questions to turn in. However, you do want to make sure that you go through chapter 12 and make yourself familiar with it before you do the final exam, because everything from the midterm through now will be covered on that final. So chapter 12 is on that final. So everything before the midterm is not on the final. It's everything after the midterm all the way through chapter 12 that will be on that final exam. So you still want to make sure you read this chapter. I would still recommend going through those end of the chapter questions just to make yourself familiar with everything. Again, just make sure you focus on getting that test completed by Thursday, because if it doesn't get done by Thursday, it goes in the grade book as a 0, and that's a huge chunk of your grades. We don't want to do that. So anyway, chapter 12 is all about hematologic drugs. Hematologic simply refers to anything having to do with the bloodstream. So we're talking about anything that deals with diseases or other things that affect the blood. So the main focus with a lot of the drugs that you're going to be talking about in this particular chapter is what we call anticoagulant drugs. So what that means is drugs that prevent blood clots from forming. So coagulation is forming a blood clot. So an anticoagulant drug is something that prevents that clotting. We have clotting occur when there's an injury. Injury releases this specific substance called thromboplastin, and it activates that clotting. So that process starts. And so there's all kinds of things that go on. There's little strands that kind of go together, and they trap red blood cells, which form the clot. We can get those clots in a lot of different places. We can get them in arteries. We can get them in veins. So what we want to do is we want to prevent those blood clots when injuries and things like that occur. Because if we have a blood clot, obviously, then the blood's not going to be able to flow properly. So we're going to use them in lots of different types of situations. Patients who have atrial fibrillation, a history of heart attack, maybe they have an artificial heart valve. Maybe we want to prevent deep vein thrombosis, which is something that typically happens in our patients who are bedridden. Pulmonary embolism. Anybody who has chronic renal failure may be put on anticoagulants. Patients who are having cardiopulmonary bypass during an open heart surgery are going to be put on anticoagulants. So the whole idea behind them is that those anticoagulant drugs basically inhibit those clotting factors, so those clotting things don't occur. And they're going to prevent platelets from sticking. So it's going to keep that sticking from happening. It's also going to decrease the viscosity of blood. Viscosity means thickness. So if you think of blood, if you think of blood as maybe being kind of like maple syrup versus water, that's what we're talking about when we're talking about viscosity. So if you've got something that's the consistency of water, it's a lot thinner. And maple syrup has a higher viscosity. In other words, it's thicker. So keep that in mind when you're thinking about viscosity. Now, the one thing with anticoagulants, heparin is one that you'll see quite frequently used, is when you do increase or lessen that viscosity, make it not so thick, you have a problem with stopping the bleeding then. So, there's kind of a give and take with these drugs. Heparin was the first anticoagulant drug that was that's been used. It's measured in something called units. We can give it subcutaneously or intravenously. It is also, though, one of the drugs that is the most common uh, error-filled drug. So a drug that has the most errors associated with it, mainly because of this clotting, or this ability to not cause blood to clot. So this anticoagulation, what's the word I'm looking for? Anticoagulation property. Another drug that you might be seeing is warfarin. Another name for warfarin is Coumadin. So it is an oral medication. So you'll see a lot of patients, getting warfarin orally if you're working in a retail setting. And then we also have some platelet inhibitor type of drugs that you'll see. Let's see, we've got, I'm trying to think of a few of them here. We've got Persantine is one. Here's a few others. Of course, aspirin. We've got Plavix. That's another very common one nowadays. You've probably seen it even advertised on TV. Then we've got some thrombin inhibitor type of drugs. Angiomax is a very common one that you'll see used. Then we also have some factor XA inhibitor drugs. Arixtra is one. We've got thrombolytic drugs. So basically you're just going to see all those different type of things, but they all are focusing on the same thing, keeping blood from clotting. So as you go through and focus on this chapter again, make sure you're looking at the different drugs specifically. You're going to also look at some of the different conditions. Like we said, people who have deep vein thrombosis, people with previous myocardial infarctions, things like that. So just make sure you're focusing on that. Again, you don't have to do those questions to turn in, but I would highly recommend that you complete them so that you're more familiar with the material in this chapter. If you have any questions at all, please make sure you reach out to me. It's been a pleasure having you in this course, and if you need anything at all, please let me know. Have a great week.